do the TED hose. So some of this I'm gonna quiz y'all, okay? You will have a kit. In the kit will be your bag, a little packet of what's called Castile soap. It's a very mild, non-irritating, and also you have a little caulk. Other supplies that you need, you're going to need a bedpan, you're going to need a graduated container, of course gloves, and a lubricant for your tube. So first of all, what position?
Left seam.
Left seams. Does anybody know why?
Because it straightens out.
Okay. So if you look at my little bow over there, that descending colon that's coming down on the left side, if you're on the left side when you put anything in, and this is for suppositories, any kind of enema, you want a left seams. And seams is a little different than just left sideline because you're going to want to take that top leg and put it over as far as you can, and that helps to expose the rectal area better, okay, so you can see better. So they're almost prone a little bit so that you can see better, and on the left side so that your fluid will go in, not have to fight gravity going in, okay? So left seams position, water temperature that you're going to put in your bag. Anybody?
150.
100 to 105.
Yeah.
150 might be a little bit warm. A little bit warm. So we don't want it too hot for what reason?
It could
And burn. We don't want it too cold for what reason? Cause cramping. So it's hard because you don't always have a thermometer handy. So you just kind of have to, figure it out by touch because you don't want it cool, but you don't want it blazing hot either. Okay, so make sure and of course you can get it a little warmer because by the time you get everything done, it's going to have cooled down some. So keep that in mind. If they can get up, we want a bedside commode nearby. If they have it, if you may be in a home situation, if you don't have one, just closest to the bathroom. Because when they feel the urge to go to the bathroom, it's probably going to get quick and hard, and they're going to be like, I got to go right now. If they can't get up, then have your bedpan. I just kind of like to have a bedpan just to kind of handle all my stuff, but even if they're not going to use it, but if they need a bedpan, have that available. Of course, you need your underpads, towels, because sometimes this can get messy, okay? So how far are we going to insert our tubing into the rectum? Anybody? How far? 4 inches. And it's going to be pointing in which direction? Toward the belly button. Okay? That's the direction it goes in. Our bag needs to be how many inches above the rectum?
No more than 18.
No more than 18, 12 to 18. Okay, and this is a gravity thing. So if they start cramping, you can, I really like a roller ball better. These, it was taking me yesterday 2 hands to actually open and close this thing. So I would just go kink, okay? If you need to stop it real quick, rather than this thing, like I said, took 2 hands and my hands were wet and slippery and it wasn't working, okay? So you can kink. Also, it is gravity, so when you lower it, that thing stops, okay? If they start cramping, of course, stop it, kink. I got all that out yesterday, sorry. If they start cramping, then, stop it. Don't take it out. Don't take it out yet, okay? Just stop your flow. To have them to take some deep breaths and see if it will pass. And hopefully it will. Just some deep cleansing in through the nose, out through the mouth, and try to relax a little bit and see if it'll pass. The key to a successful enema is getting as much in as you can, okay? If you get just a little bit and they go, I gotta go, let's try to talk them in to see if they can hold it just a little bit longer. You know, especially if you've just got a little bit in, it's not gonna do much good. What happens when you pass the tube through the sphincter, it just triggers that need to go, okay? And they just feel like they've gotta go, but if they can, the more that they can keep in and the longer they can hold it in, the more successful the enema will be, okay? And then we don't have to hopefully do this again. So you just trying to talk to them, keep them, because this is a really non-fun procedure, okay, for everybody, us included. It's not a fun thing. And then you know, when this is over, you're gonna feel better. When this is over, it's kind of like labor pains. When this is over, you're gonna feel better, okay? So when we get done with this, you're gonna feel better. You'll get some relief and you'll feel better. So a lot of this is talking and convincing and patting and deep breathing, and I usually deep breath with them. Okay, deep breath. Okay, so speaking of fluid, and you need this because you need to measure how much your bag is not real graduated, it's semi-graduated. And it's really even hard to see, but right on the side, it's got a 500, 1,000, and a 1,500 increment. Okay, so it's not gonna be precise. So you're gonna need to know how much you're putting in there before you put it in there. One of the things you need to know for checkoff is age groups. Okay, I'm gonna ask at the checkoff, okay, if this was a 3-year-old, how much fluid? Okay, so for an adult, how much do I need? 500 to 1,000. Infant, toddler,
250 to
50 to 150. 3 to 5, I have to look at my age groups, I can't remember how it's going down. 3 to 5.
200 to 300.
And then from school age,
300 to 500.
there you go. So it's in increments, so it should be fairly easy to remember, but you will be asked that. And it's probably a test question. I don't know that for sure, but likely. Likely pretty much a lot of what I've just said is possible test questions, okay? So measure what you got, don't guess, especially kids. You don't want to mess that up. So when we're putting it in, we're going to, and I'll do all this, I'm just going to try to talk it a little bit. We'll take the cap off, and we'll lubricate, okay? We'll lubricate, and this is not what you would normally have. This is what we have to use for our mannequin, okay? When we start inserting, we want to do a little gentle twisting as we go to help go through that sphincter, okay? 4 inches, and then don't turn loose of it, okay? Hold on to it, okay? Because they can, I guess the word pressurize it out, I don't know, but they can push it out. If they'll, just kind of tighten up their buttocks, that sphincter muscle kind of tighten things up, that helps keep everything in, and again, lots of deep breaths in this procedure, okay? I'll take some deep breaths as we're putting it in, okay, kind of catch up again on a deep breath before I actually turn it on, and then we're gonna see how much we can get in. Hold as much as you can for as long as you can, okay? And then we'll get up. Once they've had a bowel movement, you need to observe the results, and because you're gonna have to document all this. So was it a small amount, moderate, large, color, consistency? Everybody's had a poop in here, so there's a mild odor to everybody's poop. Brandon says his don't stink, he's lying. But there's odors that can come with bowel movements, and so if it's a distinct odor, and if you've never smelled C. diff yet, C. diff is a very distinct odor. It's kind of like gangrene. Once you ever smell it, you will never forget it, and I can detect it down the hall. I can tell you. I'm not a mind reader, but I can tell you there's gangrene in that room, or there's C. diff in that room, okay? It's a very distinct smell. So these are the things you're looking for to document. So in your documentation, date, time, of course, what type of enema did we give, because y'all are aware there are numerous different kinds. How much, so if it's, you know, one of, the soap suds are large volume, how much did we get in? What was our results? How did your patient tolerate it? And y'all have done enough. Y'all know a lot of this is every procedure. This is nothing new. Okay? All right. So I've got my, and I've used some out of this, so it's a little bit under 500 now. Got my warm water, got my soap, and after you get it in your bag, you're going to want to purge your line, which this one is kind of fine, but got some air bubbles. You don't want any air, you know, going into their belly. Y'all see what I'm talking about? It's a two-handed thing there. So, I mean, a tiny little, you know, bubble's not going to hurt anything, but you don't want like gaps. So, do a little lubricant here. Now, also, when y'all actually do the check-off, we're just going to put a little bit in, because this has a bladder in it that holds what we put in. So actually, you know, start your enema, but we're not gonna put a whole bunch in, okay? So once we get it started, you know, I'll tell you to stop, because we have to empty it out. So after 22, you'll do this. Okay, so again, that top leg over, you know, like 90-degree angle, if they are able to tolerate that, and pushed over. It's always good to have extra hands to do this procedure, especially if it's elderly or a child, because they may be scared. It's not really painful, but it's uncomfortable, and then it's a thing, you know, my butt sticking out if somebody pokes something in it. Okay, so just thinking about it, y'all gotta, you know, keep that in mind. Especially if somebody's never had one of these. So we're going to try to spread the buttocks, and so that you can see the rectum. And again, deep breath and twisting up to my 4 inches. And then I'm going to hold this. I really don't want this thing. Maybe by the time y'all get to it, I'll kind of have it worn out. So we're putting it in. I'm going to have to turn it loose to undo it. But anyway, then we're just going to open it up, put it in. Okay, so we've put in as much as the doctor has ordered, or as much as they're saying. They're like, I can't take no more. You got to stop. You got to stop. Okay. So paper towel, lid on this. So I tend to be a little klutzy. So we're going to take this out, you know, deep breaths again, but it's coming out, it's over. Just going to kind of wad that up. So, and this is all just disposable then. Now, people at home might keep one. If they have to do this regularly, they might not throw it away, and that's okay. If, you know, they clean it really good at home, but in a nursing home or hospital, we would dispose of it. Questions?